Today we are going to talk about resident rights and how they relate to the quality of life in assisted living facilities. What is the resident right? The resident right refers to how a person must be treated in a facility. These rights generally cover such areas as the quality of life, services to be provided, and informed consent issues. As citizens of the United States, the assisted living program residents have rights. Now, because assisted livings are regulated by the states, they also have rights under their state regulatory agencies and state laws. It is the responsibility of the assisted living program to protect and uphold these rights to ensure or foster respect, dignity, independence, and choice. We have all seen these residents' rights posted in facilities across the nation, or we have heard about them. Actually, we have seen or heard about them so much that they begin to lose their practical relevance with caregivers. This lecture will focus on the residents' rights, how we violate them without even knowing, and what we can do to uphold these rights in our facilities. This lecture is broken into two parts. Part 1 will cover the state of Maryland specific rights as stated in the Code of Maryland regulations, but very applicable to other states nationwide. Part 2 will cover the other rights. Right number 1. They have a right to be treated with consideration, respect, and full recognition of the residents' human dignity and individuality. Now, how do we violate these rights without knowing? Well, by talking to them using inappropriate tone of voice, addressing them inappropriately, calling them sweetheart, grandpa, pops instead of using the correct titles, by not listening with apparent interest to what they have to say. Right number 2. They have a right to receive treatment, care, and services that are adequate, appropriate, and in compliance with relevant state, local, and federal laws and regulations. How do we violate this? By not administering treatments and medications as ordered by the resident's physician, not following clinical orders issued by the delegating nurse, not answering the call bells promptly to determine residents' needs, by not seeking treatment for a condition in a timely manner. Right number 3. They have a right to participate in planning the resident's service plan and medical treatment. We violate this big time. Most times, we write the service plans for the resident without including the residents. And then we wonder why we have compliance issues. The resident was not included, and that's probably why he's not complying. I always say this: nothing about me without me. If this business concerns me, I better be included. When we include the residents in the plan of care, it promotes compliance. Right number 4. They have a right to choose a pharmacy provider subject to the provider's reasonable policies and procedures with regard to patient safety in administration of medications. When residents come into our community, some of them are coming there and they've had a pharmacist for a very long time. They have a right to retain that pharmacy. We cannot make them change to use the pharmacy that we use. We cannot say to them that because our ABC pharmacy is across the street that they have to use them. No, they may use whatever pharmacy that they want, whether it's the mail-in pharmacy or the one across the street or the one from out of town. That's their choice, and we need to respect that. Now, we may encourage them to change to what we're using, but if they don't want to, then that's their right. Right number 5. They have a right to refuse treatment after the possible consequences of refusing treatment are fully explained to them. Now, it's not enough to say that, oh, I went to give Mr. Jones his medicine and he refused. If he refused, does he have the cognitive ability to refuse? What did you do about the refusal? Did you explain to Mr. Jones the benefits of this treatment? Did you explain to Mr. Jones the consequences of the refusal? Was Mr. Jones in a position to cognitively understand what you're saying? These are all factors that you must take into consideration. If the resident has Alzheimer's and dementia, they don't have the ability to knowledgeably refuse. Therefore, we may use other strategies that we have learned in our Alzheimer's and dementia trainings. If you went to give an Alzheimer's patient his medication and he says no, he is just saying no. You have a 2-hour window in the state of Maryland in which to administer medications, an hour before to an hour after. So what you would do is return within that time frame as many times as possible. And maybe before the 2 hours are up, you may be able to get this medication into him. If this person were a person with cognitive ability and they are refusing, knowing the consequences of the refusal and knowing the benefits of the treatment, and yet they're refusing, then you would need to notify the resident's physician, their family members, the delegating nurse, and then maybe you can start talking about negotiated risks or have a risk waiver. Right number 6, they have a right to privacy, including the right to have a staff member knock on the door before entering, unless the staff member knows that the resident is asleep. A lot of times, we just swing the resident's door open without knocking. This is their home, and this is their room. And I often ask, how would you feel if you were in your room, laying down, and somebody just swung the door open without even knocking? That's very disrespectful and borders on dignity issues. Therefore, we need to make sure that we knock on that door and at least give them time to respond before we go in. Right number 7, they have a right to be free from mental, verbal, sexual, and physical abuse, neglect, involuntary seclusion, and exploitation. Now we know how not to physically abuse them. We know not how to sexually abuse them. But where we fail here is, do we know that even if we curse to their hearing, that we are violating this right? We may not have cursed in front of them, but if we curse outside of their door or outside of their immediate area, but to their hearing, that's still abuse and violation of right number 7. Did we know that if we told the resident that they had to sit in that corner because they did not eat or finish their food, that's false imprisonment and involuntary seclusion? We cannot punish the resident for not eating their food or for refusing a treatment or medication. We can only encourage them. Our residents are not kindergartners that we put in a corner for refusing treatments or for refusing medication. We need to think of other measures and other interventions besides putting them in the corner. And that's abuse and in violation of right number 7. Right number 8, they have a right to be free from physical and chemical restraints. Now in assisted living, we really don't have to worry much about physical restraints, because I want to think that that's a no-no in assisted livings. If a person is beginning to require physical restraints, then they would have exceeded the level of care that the facility can safely take care of, and therefore alternative placements need to be sought. Now, chemical restraint is a potential. When we use PRN medications, they need to be used for the benefit of the resident and not for staff convenience. So if PRN medications, which are as needed medications, then these may be psychotropics or anti-anxiety or different meds, when they are used as needed for staff convenience, that would be abuse and violation of right number 8. All meds must be administered for the resident's benefit and not staff convenience. Right number 9. They have a right to confidentiality. This is the federal right. This is HIPAA. The confidential information needs to be confidential. We can only share their medical records or their medical information with the people who are in the need to know. And there are certain people in the need to know, and this would include the resident's nurse, the resident's physician, all those who will be providing care to this resident. How do we violate this without knowing? Most times, it's not that we go about saying, oh, did you know that Ms. Jones has Alzheimer's? Or did you know that Ms. Jones is incontinent? That's usually not what happens. But what we do without knowing is giving unnecessary information, such as the janitor comes to pick up the trash. And you say, oh, John, I am so sorry that the trash is so full right now. Ms. Jones had so much diarrhea last night, and I'm really sorry. Now, that was not unnecessary. He didn't need to know whose incontinent garments are in the trash can. It's when we talk in this manner that we violate this right to confidentiality. Right number 10. They have a right to manage personal financial affairs to the extent permitted by law. If this person is able to manage their own finances, let them do it. If they are not able, then you can seek help. And you can seek help by asking for guardianship for finances, either from the Commission on Aging or from the state regulatory agencies, and they'll be able to direct you as to where to go to get guardianship for finances. Or if the assisted living manager decides to manage the finances for this resident, there are rules and regulations governing this in the COMA regulations. They have a right to retain legal counsel. And that means if the resident says to you, I need you to get me a lawyer to sue you, so to say, yes, you are required to at least facilitate access to that legal counsel. Right number 12. They have a right to attend or not to attend religious services as the resident chooses, and receive visits from members of the clergy. Here in the United States, we are a multicultural, multi-religious nation, and we all need to respect each other's religion. We cannot make a person go to our place of worship with us. If the person is of a different faith and they want to attend religious services of their faith, it becomes our responsibility to facilitate access to that service. Right number 13. They have a right to possess and use personal clothing and other personal effects to a reasonable extent, and to have reasonable security for those effects in accordance with the assisted living program security policy. When they move into our facility, one of our responsibilities is to keep their belongings safe. And state regulations have different procedures and policies in place to safeguard this right. Right number 14. They have a right to determine dress, hairstyle, and other personal effects according to the individual preference, unless the personal hygiene of a resident is compromised. Now, sometimes we may go overboard here or play mother hawk. If Ms. Jones loves to have her hair green, so be it. Our responsibility is to explain to Ms. Jones what kind of attention she's going to have from having green hair. And if she says, I don't mind, and this is what I want, then that's what she wants, green hair. And it needs to be documented in her service plan that this is what Ms. Jones likes. She likes green hair per her preference. We need to notify, because green hair is not the norm. We need to notify her family members, notify the nurse, notify her physician, or all those of interest, so that this is not looking like negligence. And this is the resident's preference, and we need to honor that. When we start making a big fuss about the green hair, it's not about the resident anymore. It's about our feelings, and we cannot bring our feelings to interfere with the preference of the resident. Right number 15, they have a right to meet or visit privately with any individual the resident chooses, subject to reasonable restrictions on visiting hours and places, which shall be posted by the assisted living manager. So yes, they have a right to visit with anybody of their choice, whether it's the priest, the imam, the boyfriend, or the girlfriend. And we need to honor that privacy, as long as it is within the visiting hours posted by the assisted living program. Right number 16, they have a right to make suggestions or complaints or present grievances on behalf of the resident or others to the assisted living manager, government agencies, or other persons without threat or fear of retaliation. Right number 17, they have a right to receive a prompt response through an established complaint or grievance procedure to any complaints, suggestions, or grievances residents might have. And they need some response to a complaint within 24 hours of that complaint. Right number 18, they have a right to have access to the procedure for making a complaint to long-term care ombudsman program of the Department of Aging as set forth in the COMA regulations, the Adult Protective Service Program of the local Department of Social Services, the Office of Healthcare Quality of the department, and designated protection and advocacy agencies if applicable. Right number 19, they have a right to have access to writing instruments, stationery, and postage. The elderly of our times are not in the computer age, so most of them are still writing letters and sending postcards. So if they need these writing instruments, it's our responsibility to facilitate access to these instruments. Right number 20, they have a right to receive prompt, reasonable response from an assisted living manager or staff to a personal request of the resident. Right number 21, they have a right to receive and send correspondence without delay and without the correspondence being opened, censored, controlled, or restricted, except on request of the resident or written request of the resident's representative. This is federal. Nobody has a right to open anybody's mail, but sometimes assisted living managers or caregivers get pulled into this when family members would probably call and say, oh, can you check to see if my mom's check arrived? Well, if they want you to check on mom's check or something, they need to give it to you in writing, and then it would be in the service plan. But if not, then nobody has a right to open anybody's mail, and that still applies to the elderly. Right number 22. They have a right to receive notice before the resident's roommate is changed, and to the extent possible, have input into the choice of roommate. This is under relocation in the regulations. If they're going to have a roommate, They have a right to know in advance and not to wake up at 2 a.m. in the morning. And oh, by the way, this is Mrs. Jones, she's your roommate. She came in at 1 a.m. You know, courtesy requires that we give them some time to deal with the transition. And our regulation says 5 days. Right number 23. They have a right to have reasonable access to the private use of a common use telephone within the facility. The facility is responsible to provide one telephone for the use of the residents. Now, if you have a lot of residents, the regulation states what ratio of telephones you should have per resident. And assisted living facilities need to consult the state regulatory agency to find out what that ratio is. Right number 24. They have a right to retain personal clothing and possessions as space permits, with the understanding that the assisted living program may limit the number of personal possessions retained at the facility for the health and safety of other residents. This is very touching. When people move from their homes or from their apartments, they are moving from a big house or from an apartment to a small, relatively very small room. And it becomes a major dilemma. What do they take with them and what do they leave? So as assisted living owners or managers or workers, we need to encourage them to come in with as much as possible, as long as there is space and it's not being a fire hazard. They can come in with things like a favorite pillow or a comforter or a chair or something that keeps them in connection with their home. Right number 25. They have a right to attend or not to attend adult daycare. And they have a right to attend one of their choice, should they choose to attend one. And we cannot make them go to one because it's close to the house or because it's far away from the house. They have a right to choose which one they want to attend. Right number 26. They have a right to be oriented to the residents' rights and a copy given to each resident or resident representative on admission. Now we go on to the other rights. And these rights are also applicable in the state of Maryland and nationwide. They have a right to choose activities, schedules, and daily routine. They have a right to receive the services stated in the service plan, the resident agreement, the uniform disclosure forms. They have a right to be fully informed in a language and manner that the resident understands. If you have a resident that speaks a different language, you cannot talk to them in English if they don't understand and then have them sign papers, because it would be null and void because they did not understand what you were saying. So it becomes the responsibility of the assisted living manager to communicate with the resident in the language that that resident understands. They have a right to refuse to perform work for the facility. They have a right to be compensated appropriately for consensual work done for the facility unless the resident declines the compensation. Any such work must be documented in the residence service plan. They have a right to be free from financial exploitation. We cannot borrow money from the residents. We cannot use the residents' money for anything other than something for the residents. They have a right to be discharged, transferred, or evicted in accordance with the resident agreement. They have a right to be informed in writing of fee changes in accordance with the resident agreement. They have a right to be encouraged to exercise their rights. They have a right to form resident councils, because resident councils give residents a voice in the community and fosters a sense of belonging. This is Ann Saka, wishing you success in the implementation of these residents' rights as we continue our pursuit of excellence.